So much of what we do is about building partnership, and what that word actually means is it means a degree of mutuality. It's not someone doing to something else, it's about people coming together with mutual respect, shared understanding to see how they can build something that is bigger than the sum of the parts. And I think this is an absolutely prime example, as you said, Director General, of the way in which you bring together the corporate sector, the not-for-profit, the public sector, and build solutions which work on the ground. And for policymakers like me and diplomats like me, just remembering that it's those things that work on the ground are the ones that really matter. And relationships are at the heart of that. And you build relationships through programs that have this sort of longevity. I was actually particularly struck by this during the horrible, awful month we've just been through with the Westgate attacks. Actually, when push came to shove, the things which made the difference were those personal relationships, that understanding that is built through programs like we were seeing. It's absolutely vitally important. So that collaboration, that mutual respect, that shared understanding, that's what partnership means for me. I should mention in that score some of what we do from the British High Commission, because I would be in trouble with my good friends from DFID, who run our UK aid programme. Just an example of how we support some of that effort. The DFID Kenya Health Programme, this is over about 5 years to 2018. We're now looking at about £250 million sterling worth of investment in Kenya. We don't shout about it a lot from the rooftops. That covers family planning, maternal health, malaria. We've heard about some of these, and I think it's absolutely fantastic what my colleagues at UKID are doing. That's about, if my maths are right, 325 billion Kenyan shillings, have I got that right? I mean, it's a phenomenal amount of investment that is coming in, and it's absolutely in that spirit of partnership. And some of the headlines we should be proud of. I know the rate of infant mortality in Kenya decreased by 32% between 2003 and 2009. Many reasons for that, some vaccinations, some of the malarial bed network, but that is a fantastic figure, and we must all be resolved to continue that sort of trend going in the right way. And finally, as well as the word partnership, which I think we can all support, it's a phrase which we used, which is changing lives. And again, with an awful lot of politics going on and an awful lot of noise, I think actually changing lives is what we should remember that we're all about. It's making a difference to some of the patients we are seeing on screen, some of the people in communities that is going to be so transformative in Kenya. And I'm very fond of reminding people that 70% of Kenyans are under 35. And when you look at the opinion polls, what people say they really want is what people all over the world say they really want. It's good health, it's dignity, it's a chance to get on, make a living, and have jobs and opportunities for themselves, their loved ones, their children. And that's why we need companies like GSK doing all the brilliant work they do here, bringing in investment, helping provide jobs, helping grow the economy. That's why we need partners like AMREF doing all the brilliant work that they do.